the relationship of mainly this COVID-19 and how it is affecting the lungs because of this ongoing pandemic, and what sir has started to help us with the lung exercises and all. I would like to concentrate mainly on the lung, how it affects our lungs and how we can protect it. Okay, so apart from the basic symptoms like what we are seeing, like fever, sore throat, cough, breathlessness, all these things we have been noticing since last year. But the new symptoms now we are noticing are abdominal pain, vomitings, diarrhea for some people, and like redness of the eyes, and even the hearing issues. So these are also the new symptoms we are noticing. So if any, so we should also keep in mind of the new symptoms, and we should not neglect this, because initial treatment would help us to prevent the further lung damage. The lung damage in this can be temporary or permanent in some, depending on the intensity. So we'll see how it damages the lungs. So what does this COVID do to the lungs? So it causes mainly lung complications like pneumonia, and in most severe cases, it causes acute respiratory distress syndrome. So other possible complication is sepsis, that is infection, which is causing harm to the lungs and other organs also. So this is more severe, and when compared to the pneumonia also. And as we have learned more about this virus, like SARS-2 COVID virus, there is significant inflammatory condition which is causing the complications in the patients with this. So what is this pneumonia? So when the virus enters the body, so through the trachea and all, it starts entering the bronchi, bronchioles. So the end parts of these trachea and bronchioles is the air-filled sacs will be there. They are called alveoli. Okay, so these alveoli are air-filled sacs. They help us in exchange of the gases. So when this COVID virus attacks us, so it mainly affects the alveolar epithelium, that is the lining of these air sacs. So the damage caused with it reacts, the body responds to in the form of inflammation. Body's response to fight the virus causes inflammation in these sacs. So that results in fluid collection in these sacs, and it causes pneumonia. So when there is infection in these lungs and the collection, the exchange of gases gets hampered, and so that results in breathing difficulties, and we will not be able to breathe in oxygen and give out the carbon dioxide. That causes respiratory difficulties in most of the patients. So see, let me go through this. In pneumonia, the lungs become filled with the fluid and inflamed, leading to breathing difficulties. So because of the air-filled sacs, the alveoli are damaged with this virus. There is collection of the fluid and the body's response. This results in, maybe you are hearing this cytokine storm. So with this inflammation and the body's response, there will be cytokine storm, that is release of some chemicals in the lungs, which damages the, which is able to fight the infection, but as well, it is very severe, that is, it is causing damage to our own lungs also. That causes these difficulties. So for people, the breathing problems can become very severe to require treatment at the hospital with oxygen or even a ventilator. Because of this lack of exchange of the gases, this we need oxygen therapy, or in more severe cases, a ventilator. So this pneumonia which affects us, it affects both the lungs. Okay. So as this pneumonia progresses, more of the air sacs become filled with this fluid. So it is leaking from the blood vessels. So mainly the air sacs are connected to the arteries. The vessels will be there. So the air sacs, from these air sacs, the blood vessels take the oxygen to the lung tissue, complete lung tissue. So when these air sacs are damaged, there is no oxygen from the vessels to the tissues. So that causes tissue damage, that is a lung damage. Eventually, the patient will have shortness of breath, and it can lead to acute respiratory distress syndrome. It is a kind of a lung failure, that is a failure of the lungs to perform the regular activity. So the patients with acute respiratory distress syndrome, they're unable to breathe on their own. So this requires ventilatory support to help circulate oxygen in the body. And coming to the sepsis, it occurs when the infection reaches and spreads through the bloodstream. It causes tissue damage wherever it goes. So along with the lungs, the other functioning organs like the heart and other body systems which also work together, they also get damaged. So we are seeing some heart complications also in many patients. So this sepsis can leave a patient with lasting damage to the lungs and other organs also. So the immune system, which is working hard to fight the virus, can leave the body more vulnerable to infection with other bacterium also, or virus. When the immunity is less, it becomes vulnerable to other infections also. That causes more lung damage. So what I want to say is, with these lung exercises and all, once we improve our lung capacity, breathing problems, even if we are infected, the infection will try to overcome it in a better way. So if the infection is mild, that is like very less involvement of the lungs, the medication, home care would be enough. But the infection, if it is severe, what I would like to suggest is, if any one of us or any of us neighbors or anyone get infected, we should observe for the symptoms, not just home isolation or quarantine is not the thing now. So what we have to do is we should keep monitoring ourselves for the oxygen saturations and other symptoms. And once we get infected, please, like the testing should be mandatory. Like after 5 days, we should go for the inflammatory markers. That is more significant in this crisis now. So because most of the deaths are because of the complication. So we should get tested for these inflammatory markers. There will be some specific inflammatory markers for the COVID infection. So once we are infected, around 5th day, we should get these tests done and a CT scan to evaluate the involvement. So depending on that, we can doctors will suggest it should be a home isolation or hospitalization. So early intervention and precautions from us would help us in a better way to prevent the further lung damage. Because once the lung is infected, if it is more severe, the place where it is infected, it becomes hard. That is called fibrosis. So the expansion of the lungs comes down. So what I can say is, with these breathing exercises and whatever sir is doing, training us now, would help to improve the lung capacity with infection or without infection to be on the safer side. So the lung capacity should be improved and the breathing difficulties will be less with this. So that's all for now. So basically, in relation to the lung, I wanted to speak a few words. And thank you, sir, for giving this opportunity.